use tramadol way too much. I don't think that dogs, as a general rule, respond to it as well as we think that they do. And I think we actually need higher doses than we have been using. And then you get more side effects like sleepiness. So the question then becomes, are you really helping with the pain, or are you just making them really tired so they're not moving so they don't seem painful? The next category is gabapentin, and this medication is for nerve pain. And in the canine cognitive dysfunction lecture, we talked a little bit about gabapentin. The actual mechanism by which gabapentin works is not fully understood, but from what we can glean, gabapentin reduces nerve pain, but it also prevents what's called allodynia, which is sensation of pain that results from a normally non-noxious stimuli. So basically, that idea we talked about of facilitation, where like a non-painful stimulus causes a pain response. Gabapentin is supposed to help with that. It's also supposed to help with what's called hyperalgesia, or an exaggerated pain response. So gabapentin can definitely be very useful in arthritic conditions, as well as if they have chronic disc disease issues, because it helps with that kind of idea of nerve pain, wind-up pain. There is another category called NMDA antagonists. And if you remember a little bit earlier, we talked about one of the ways that you get wind-up pain is through these NMDA receptors. So if you block the receptors, you in theory should be able to prevent the wind-up pain. The most common drug we use is called amantadine. And my personal use with it, I find that it works best if you use it like in 3-week increments. But some veterinarians use it chronically. I have used it chronically, but in my experience, it seems like it helps best if it's used in kind of like short bursts. And it doesn't mean you can't reuse it, but I think the body almost gets sensitized to it and it's not as helpful. Ketamine is within this same family, and so microdoses of ketamine can also be used. But because ketamine is a controlled substance, we don't generally use it as often. Nutraceuticals, which is the fancy term for nutritional supplements, are another category that we really take advantage of in veterinary medicine for arthritis and for pain management. The two kind of combination ones I like the best are Dasaquin Advanced, which has glucosamine, it has MSM in it, it has turmeric, it has this avocado, soybean, unsaponifiables, and it really does help with improving joint health and reducing inflammation. Glycoflex is another one that has this glyco-omega, which is a patented product that comes from green lipid mussels, and it also contains DMG, it contains glucosamine and MSM. Other nutraceuticals to consider are things like Adequan, which is an injection. It's basically injectable hyaluronic acid, so it improves joint health. Duralactin, which is kind of a weird concept in my mind, but it's dried milk protein, and it also helps with inflammation. Fish oil is fantastic, especially omega-3s, in particular DHA and EPA. Elk antler can be used. Boswellia is a natural anti-inflammatory. Turmeric is a great anti-inflammatory, and also CBD oil. This kind of category of nutraceuticals, especially in the realm of pain management, we're going to talk about in more detail in a different podcast, but I just kind of wanted to briefly mention them here. Another possible category of supplements we can use is something called homotoxicology. And homeopathy is when you use very dilute amounts of certain substances to treat a condition. Homotoxicology is where you take a bunch of different homeopathic remedies and you mix them together and you use that to help a condition. True purist homeopaths don't like homotoxicology. And it's funny because one of the veterinarians that I practice with is certified in homeopathy, and I use this supplement called Tea Relief, which is a form of homotoxicology. So it makes her a little ticky. But all of those homeopathic remedies together, I find, really can help reduce inflammation. I'd say it's about 50% effective. Like 50% of my patients, cat and dog, respond to it. The nice thing is that it's benign. There's really not a lot of side effects. It's inexpensive. So worst case scenario, it doesn't work. It doesn't cost a lot of money for it not to work. Chinese herbal therapy is another option. There's a lot of Chinese formulas that can help reduce pain. And it can also be used in conjunction with other modalities, including regular Western pharmaceuticals. Acupuncture is huge for pain, and we'll definitely have another podcast about acupuncture. But in kind of a brief summary, it's a treatment modality that uses small needles that are placed in specific locations on the body, which then cause an effect. And it can be used to reduce pain that's associated with nerve and muscle problems. It can improve nerve function. It can improve the immune function. It can regulate the gut. It can reduce inflammation. It can balance hormones. It can improve blood flow and circulation. So there's a lot of applications for acupuncture. VMSMT, or veterinary spinal manipulation therapy, also known as animal chiropractic, follows the basic premise that if you relieve abnormal spinal problems, that allows the body to heal itself, and that any changes in the spinal cord or the nerves coming off the spinal cord can cause various diseases and pain syndromes. So it's really a holistic medical, whole with a W, holistic medical system that utilizes this just intense understanding of the nervous system to locate areas in the spine that are not moving as well as they should, providing an adjustment to that area, and then allowing the body to heal itself. And we use what are called high velocity, low amplitude thrusts. So these are quick, light, not very forceful thrusts that adjust the spine. Cold laser therapy, laser actually is an acronym that stands for light amplification of the stimulation of the emission of radiation, which I did not know that until I started learning about cold laser therapy, and I can never actually remember what the full acronym is. So I'm not going to lie, I had to look that up. And in cold laser therapy, we're using low-level lasers. So we're not thinking about, like in Austin Powers, the sharks with laser beams. We're not talking about surgical lasers that can cut. And we use it to reduce inflammation and relieve pain and help with healing. And what happens is the laser sends photons or light rays that have these packets of energy deep into the tissues, and it's not damaging the tissues. But then that light energy is absorbed by the cell, in particular this portion of the cell called the mitochondria. And that causes a chemical change that we call photobiomodulation. And that light energy makes the cell produce more energy, called ATP, that then allows the cell to heal itself and kind of repair itself. And it reduces further injury in that same area. So really, when we think about it, cold laser reduces pain and aids in healing. The two most common types of cold laser used are a class 3, and there's a class 3A and 3B, or a class 4. And a lot of people have this huge debate, more is better, but realistically, both have their applications and both can be very helpful. Along those same lines, there is a product called an CC loop that really is like a circle with a battery pack on it. I had one client tell me that they called it the flux capacitor, which instantly made me want to start saying, do you know what this means? Do you know what this means? This damn thing doesn't work. For those of you who know Back to the Future, you are welcome. For those of you who have not seen the movie, you should go watch it. So the way the CC loop works is you have this circle, you put the area of interest in the center of the circle, and it emits these bursts of microcurrent electricity, and it targets the area in the center of the circle, and it penetrates the soft tissue, and it activates the nitric oxide cycle, which is key in helping with healing in humans and animals. And it's also the compound that's released when we exercise and when we're injured that allows the body to naturally heal itself. So the loop increases the nitric oxide production, speeds healing, and it can help with skin, tendon, ligament, bones, and organs. And just as kind of a warning, it's extremely safe, but it is what's called a PEMF, or a pulsed electromagnetic field, also known as an EMP. So you don't want to put your cell phone in the center of it. If you have a pacemaker, you don't want to use it. Other than that, really, really safe. And I think very effective. And what's nice is that I usually have clients purchase the CC loop and take it home. And each loop gets 150 uses. And basically, when the battery pack's dead, the battery pack's dead. A lot of people have tried to change the battery pack. It doesn't work. But it's nice because it's these 15-minute sessions you can do at home, and you don't have to bring your pet, especially if they get nervous or they're not traveling well, into the clinic. And it just aids in healing. And if you have a pet that is prone to falling, or even if you have a pet that you're using it for a specific cause and then they injure themselves further, they can do it immediately if they have it at home to prevent further pain. Another idea is what's called trigger point therapy. And trigger points are these knots or taut bands that are within the muscle and the myofascia, like the tissue covering the muscle. And they're usually from overuse or trauma or persistent muscle contractions, or if you're immobile for prolonged periods of time. Certain hormone disorders like hypothyroidism can contribute to them, iron deficiency, vitamin B deficiency, and osteoarthritis. And they feel like these little taut bands within the muscle. And in people, they commonly have trigger points. We call them knots. And a lot of times they're actually scar tissue that's started to form. And if you push directly on it, it can be really painful. They can have active ones that cause immediate pain. They can have what are called latent ones, which are uncomfortable but not acutely painful. In pets, it's really hard to tell if you push on a trigger point if they're reacting because it's acutely painful or latently painful. It's usually just painful. And there's two main kind of ways that you can treat trigger points. Massage or stretching of that area to try and stretch out that muscle is useful, as well as needling. And when we needle, we're actually sticking an acupuncture needle directly into the trigger point to irritate it, to get it to relax. And generally, if I do trigger point therapy, I do it under sedation because it's not a very pleasant sensation to piss off a trigger point, make it spasm until it basically exhausts itself. So I sedate them so they don't have to feel it. When they wake up, sometimes they're a little sore, kind of like if you've had a deep tissue massage, but generally it's not an acute pain, and within 24 hours they feel much, much better. The last category to think about for helping with pain is rehabilitation. And there are certified veterinary rehabilitation specialists, and they're extremely helpful. The veterinarians, as well as the licensed technicians that are certified in rehab, can really help improve mobility, just like with us. If we injure ourselves and have to go to rehab, they do it the right way. And a lot of times people try and do it at home, and they can either not do correct exercises, overuse, underuse the muscles, and kind of cause worsening of the condition. So rehabilitation is definitely something that I really am a strong supporter of, and I think that as we progress in veterinary medicine, we're going to use it more and more. So this was just a brief-ish summary of the multimodal approach to pain, as well as the complexity of pain. And like I said before, we'll talk about different categories that we briefly discussed in this podcast in more detail, but this way you just kind of have an overall approach to how we treat pain. So if your animal injures themselves or if they have arthritis and you think that some of these modalities we talked about would be helpful for your pet, talk to your veterinarian about it. You know, pain is something we definitely want to control and we don't want to allow it to continue. So your veterinarian will be more than happy to discuss options with you. I think that about wraps it up. As always, thank you for listening to this installment of Vetsplaining. I hope you enjoyed your time with me and ideally learned at least one new thing for the day. If you have any questions or suggestions for future topics, feel free to leave a comment below or email info@independenthillvet.com and put podcast topic or podcast comment in the subject line. Until next time.